Hi, my name is Rod Flynn, and I'm a surgical oncologist working for the Sentara Health Network. I'll be taking care of patients with cancer on the peninsula and beyond. I've been in practice for approximately 18 years. I primarily take care of patients with cancers of many areas, to include the abdomen and gastrointestinal tract, as well as the skin, breast cancers, and also rarer tumors such as sarcomas. I also take care of patients with very advanced cancers that have spread within the abdominal cavity and to other specific organs. I have a clinical practice in which I take care of patients with multiple cancers, but I also have a leadership role in helping to design the vision for taking care of patients within the Greater Peninsula region. I'll be the medical director of the Peninsula Oncology program here, and my goal will really be to take care of all of the patient's needs and to enhance the patient experience of all patients with cancer that we treat. I come from a family of a few doctors. My father is a retired radiologist. I also have an uncle in the Washington, D.C. area who's a cardiologist. And so my father comes from Jamaica, and he was one of 11 children. And his path to this country was a rough and difficult one, but the perseverance and the hard work that he put forth to get him here was inspiring to me in terms of my career path. He never pushed me specifically to going into medicine, but I'd go to work with him, and I just saw how he interacted with patients and his bedside manner and the way he engaged the staff as well, made everybody laugh and smile. And so we have similar personalities. And so when I would go to work with him sometimes, I would just look at him and say, I could see myself doing something like that as well. So he was a big role model in getting me to think about going into the medical field without specifically pushing me in that direction. My approach to patient care is pretty simple. I listen to the patients, I give them a voice. They're empowered in their treatment plan. And the only way to be empowered is, first you have to know and have insight into your disease process. So I think one of the things that I really focus on is making sure that the patient understands all the components of his or her cancer or disease process. And I think knowledge is power. I'm all about taking care of patients right there in the community. And Sentara is a great health system, and they are focused on taking care of patients in the community. So these patients don't want to have to travel other places to get their treatment. And so my goal is to really roll up my sleeves, and even in my leadership role, to make sure that we can give patients the best care that they can possibly get here at home, where they could be among their loved ones as they're enduring the treatment.